Hello everyone. Today we are going to study about the inguinal canal. Inguinal canal is an intramuscular passage which is present in the lower part of the anterior abdominal wall. So the inguinal canal is about 4 centimeter in the length, which is directed downwards, medially, and forwards. And it has it running from the deep inguinal ligament, so deep inguinal ring, as we can observe in this. The deep inguinal ring, it is the oval opening in the fascia transversalis, which is present at 1.2 centimeter above the mid-inguinal ligament, the mid-inguinal point. Okay, and then it is running from the deep inguinal ring to the superficial inguinal ring. This is superficial inguinal ring, and the superficial inguinal ring, it is in a triangular opening present on the external oblique aponeurosis. It has two crux, as you can observe the two borders, and its base is formed by means of pubic crust. Next, now the boundaries of the inguinal canal. The anterior boundary of the inguinal canal is formed by the muscle external oblique aponeurosis, as well as laterally. Okay, it is in its lateral one third. In its lateral one third, it is formed by means of fleshy parts of internal oblique muscle, and the posterior wall is mainly formed by means of the fascia transversalis, and the in medial two third by the conjunct tendon, and the roof is formed by the arching fibers of the transversus abdominis and the internal oblique muscle, as we can observe. Next, the floor is formed by means of the upper grooved surface of the inguinal ligament laterally, and in medial part it is formed by the lacunar ligament. Okay, you can observe the inguinal ligament holded by the forceps, and in its medial part, in deeper aspect, it has a lacunar ligament which is forming the roof. Now the contents of the inguinal canal are uh, the contents of the inguinal canals are: in case of male it is spermatic cord, and in case of female it is round ligament of uterus, and along with that in both sexes there is a presence of ilioinguinal nerve. And the contents of the spermatic cords are ductus deferens, papiniform plexus of vein, and it contains three arteries and three veins. The three arteries are cremasteric artery, testicular artery, and artery to the ductus deferens. And the three veins are genital branch of genitofemoral nerve, and the three nerves which are genital branch of genitofemoral nerve, and the somatic plexus present around the cremasteric artery and the ilioinguinal nerve. Then and the lymph vessels.